Hi, and welcome to Mindful, Beautiful, and Thriving, a podcast series by Tharaka Foundation focused on youth mental health. Before we begin today's episode, I just wanted to let you all know that all content that is found in our podcast is created for informational purposes only. This content is not intended to be a substitute for professional medical advice, diagnosis, treatment, or therapy. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition, and never disregard professional medical advice or delay in seeking it because of something you have heard in this podcast. Thank you so much, and without further ado, let's get started.
Hi, everyone, and welcome to Mindful, Beautiful, and Thriving. My name is Annika Warrior. I will be your host today. This is our third episode of the Therapist Off the Clock series. And today I am joined by our amazing clinical psychologist, Dr. Jennifer Kuhn. Dr. Kuhn, would you please introduce yourself?
Hi, Annika. Thanks so much for inviting me. It's a pleasure to be here. My name is Dr. Jennifer Kuhn. I'm a clinical psychologist. What that means is that I have a doctoral level degree. In my case, it's a PhD, but other clinical psychologists might also have a PsyD degree. And clinical psychologists can work in a variety of settings. I am currently the director of a group practice in the community in Campbell called Juniper Psychology Group. And we work primarily with children, teens, and their families.
Wow, that's amazing. I would love to know a little bit about your journey to becoming a clinical psychologist, and if you would be willing to kind of talk about what first drew you to the field and how you were inspired to pursue this career.
Absolutely. I think I first started being interested in psychology, although I didn't really know the word for it at that time, as a teen. And what I mean by that is I first realized that I was very interested in learning about different people's perspectives. I was fascinated by the idea that we could all live on this planet Earth and have very different lived experiences and very different minds that we have. So what I mean by that is that I read a book by Temple Grandin, and she's a person who identifies as autistic. And the title of the book is called Thinking in Pictures. And she talked about her childhood and her life and how generally when she's problem solving, she's thinking in pictures. She's seeing a visual spatial problem in her line of work. She actually consults with the meat industry and so helps design more humane slaughterhouses. And so she talked about how she would envision the problems that would come up in terms of literally routing the cows through in a peaceful, calm way so that to lower the instances of needing to use more like, I don't know, like prodding electric prods and that kind of thing. So I'm a person who does not think in pictures. I tend to think in words and process things in words. So that idea that she had that perspective was fascinating to me and really drew me to want to understand others' experiences, whether it's based on race, culture, upbringing, so many different factors.
Oh, wow, that seems amazing. I think that the initiative that your friend or that, can you correct me, was that your friend or was that a book that you read? I think that's what you said, a book.
Yeah, I read a book. I actually did meet with her. When I was
Amazing.
in college, I ended up inviting her to give a talk. And so I got to spend a couple of days with her. So that was fascinating to have read the book. And because she was so central to my journey, to meet her in person was a fabulous experience.
Yeah, that seems really amazing. So that was kind of, I wanted to ask a follow-up question about that. That was mainly the thing that like drew you to psychology after reading that book.
I feel like that was the first start where I started thinking about others' perspectives and how minds could be very different. I also was interested in, excuse me, learning more about children and how children had different kinds of anxiety or could suffer from depression or lifelong challenges like autism and ADHD, which we both know can be challenging, but can also have individual gifts and unique ways of experiencing the world.
Yeah, that's amazing. Were you interested in working with kids like kind of after reading the book that you talked about, or like how did you kind of spark your interest in like working with kids?
I was always interested in children.
Mhm.
So as a teen, I gave piano lessons to some neighborhood kids and really enjoyed that. It wasn't until I was in college, in undergraduate school, that I was really able to take my first psychology course. At that time, they didn't offer a psychology course in high school. I know that many high schools now offer, which I think is awesome. I also took some anthropology courses. And I would also recommend if anyone's interested in psychology and anthropology to take some sociology courses because all of those are related fields that I think influence one another. So it wasn't until college that I feel like my interest in psychology specifically was sparked, but I can trace it back to the roots of my high school, my high school time. In college, I also worked as a behavioral aide for a young child in preschool who had autism in terms of helping him with some social skills in a naturalistic environment. And then right after high school, I took a year off to apply to graduate school. And during that time, I also had a job as an applied behavior analysis technician for children with autism. And that was very eye-opening and rewarding because I got to go into kids' homes and provide services to them.
Wow, that's amazing. And then as you mentioned, I think it's a really rewarding career, and I think your background in working with kids can definitely make a huge impact on so many people. So, thank you for sharing that.
Sure.
Would you mind talking a little bit about what a typical week would kind of look like for you?
Absolutely. Well, I have to say, I love my job because I get to do so many different kinds of activities in terms of interacting with teachers, with parents, of course, with kids and teens themselves, and in different settings. So sometimes if a child's having some behavior challenges at school, I might go and observe the classroom and see the child in that classroom and see it's kind of a little bit like detective work. If a child is, misbehaving, right? Well, is what is at the source of that? Is it that a child is anxious and so they don't want to do the reading exercise? Is it that a child has difficulty focusing? So they might get extra wiggly or start poking the person next to them. Do the problems happen more on the playground in terms of sharing or getting into constant arguments with peers? So that is one example of an activity or an intervention that I'll do is a school observation, and then also talking with the teachers and talking with parents to hopefully provide recommendations of what can help a particular child. Another thing that my weeks are filled with is doing parent consultation work. So, meeting with parents, talking about their child, understanding their child's developmental history and who their child is as a person, what they enjoy, what they really dislike, where the pain points are for their child right now, what area of life that they're particularly struggling with, how it's affecting the family. And then I often meet for individual therapy with children and teens. And sometimes that can look very different too. It can look like doing play therapy with different toys and puppets. I have tons of wonderful ways for kids to engage and express themselves through play when they're younger because they're not it's harder for younger kids to have a conversation back and forth. But if you put out play materials that were related to school and they're having a challenge at school, sometimes they can express themselves by showing what happens at school or just making scenes about the playground, etc. The other thing that I do is that I train new psychologists or new mental health clinicians on different evidence-based treatments for children. So one example of that would be cognitive behavioral therapy for children who are having challenges with worry or anxiety.
Wow, it seems like you do it all. So from what I understand, there's a lot of different aspects to your job. There is actually observing in like classrooms and in like a school setting, talk therapy. I was curious on like whether you do actual like assessments on children and what clinical psychologists can do and what they can't do and like differentiating
Mhm.
those two things.
Yeah, great question. So yes, I do assessments. And so there are different kinds of assessments. There are assessments that are definitely more therapeutic specifically, and then there's broader comprehensive assessments that are more diagnostic, that involve much more testing and bringing the child in several times and having the child, and if the child's of age, and the parents to fill out many standardized behavior questionnaires. We do projective drawings and where kids can express themselves that way about their life in a different way than it's just verbal. So so yes, the in terms of the assessments, those typically are pretty comprehensive and take about a month. And sometimes a child has been having challenges for a while and may be identified as having those challenges by parents or a pediatrician or referred by their school. Some kids will come in because they're having social challenges. Other kids might come in because they're not talking in certain situations, and that's making it really hard for them. There's an anxiety disorder that's called selective mutism. So that would be one example of a referral that I might get, or someone else, another child psychologist might get. In terms of what psychologists cannot do, is we cannot prescribe medicine in California. So I think there are a few states where you can get advanced training to be eligible for that privilege, but that is not something that's within typical clinical psychology training. What we can do is we can provide diagnoses according to the five, which is the Diagnosis and Statistical Manual, fifth edition.
Mhm.
Um, and then we, that basically it's similar to a medical model in which physicians will look at what the person's symptoms are, and then through detective logic determine what the source of the problem is, or the symptom compilation, like the what it is. They might not necessarily understand all the specifics of the source. And every day we're learning more about neuropsychology in terms of what's actually happening in the brain now that we have functional MRIs and such. So in terms of what we can do, there are also clinical psychologists in lots of different settings. So there are clinical psychologists in hospital settings to help children and teens cope with really difficult traumatic situations or really medically difficult things. And one of the parts of the training for a clinical psychologist is having different rotations or practicum experiences, not just classes, but sort of hands-on experience with a, a supervisor in different settings. So for example, for me, I worked in an inpatient eating disorder unit, and then I also worked at Stanford Children's Hospital, and then I also worked at the Children's Health Council doing a wonderful internship and postdoc experience where I really got to delve deeply with a lot of wonderful supervisors and support to learn about so many different kinds of challenges and the best way to help families with those.
Yeah, it seems like there's a lot of like flexibility within clinical psychology and you can work in various fields. Would you agree?
Yes, you can work in various settings, like hospital settings, and with certainly integrated medical practices. So alongside pediatricians, and then a private practice as well.
Yeah. So as a part of your role, you do parent-child interaction therapy,
Mhm.
PCIT. And I was wondering if you could please share a little bit about your role in testing for like private schools, as well as just your overall observation aspects.
Sure. What would you like to know specifically about those areas?
like how you kind of start off that process and how long does it usually take?
Sure, sure. So it's referred to as IQ testing. I prefer the language cognitive assessment because that's really what it is. And it's really a getting a snapshot of how a child, it could be an adult, but in my case, I work with children, thinks and problem solves. So it is in my office, and there are different tabletop activities that involve looking at pictures and answering questions and puzzles, those kinds of activities. And it takes about, I don't know, 45 minutes to an hour and a half, depending. And we look at different areas of a child's cognition, such as visual spatial, reasoning, and verbal comprehension, processing speed, things like fluid reasoning, which really just means things that can't be taught explicitly. So just a child's internal logic applied to a novel situation. And then things like working memory. How strong is a child's ability to hold some information online, kind of like, I think of it like a whiteboard behind your forehead for 5 or 8 seconds, and then be able to manipulate information there and then share it in a different form. What's the last one? I think I talked about all of them. The 5 different areas that contribute to a child's IQ test. And what can be really helpful about that is helping parents to understand how their child thinks, so that if they're more of a visual learner, if parents are helping their kid with homework, they can do examples in that way. If they're more of a verbal learner, obviously talking through different situations can be helpful. And sometimes children have kind of flat skills, meaning even skills across those areas, and sometimes it's pretty bumpy. And so when the more bumps there are, sometimes the child can get frustrated because their ability to comprehend and process in one area might be very different than in another area. So we see that, for example, for children and teens with ADHD, which is attention deficit hyperactivity disorder, which is really basically, I say the word disorder, but it's it's an example of a kind of mind that we know some people have. And I think more and more our field as clinical psychologists is moving away from this kind of pathological, oh, this is atypical, this is abnormal, this is, because we're finding that there's just that more of a normal variation, but different kind of ways that minds can be wired. So for the profile of ADHD, for example, children typically have a lower working memory and stronger areas or other areas like the visual spatial reasoning, for example. Let's see, or verbal comprehension. In terms of, I think you asked one other thing about, the parent-child interaction therapy. Right. That is a really wonderful and fascinating intervention for young kids ages 2 to 7 who are having some kinds of behavior challenges with their parents or in the community or even at school. Mm-hmm. And what's wonderful about that treatment is it's the most researched treatment for children. And the way that the treatment is provided is that I have a different room in my office suite that can be set up for a child playing with their parent. And I give the parent kind of a bug in the ear so they can hear me, but the child can't hear what I'm saying. So I have the parent play with the child, and then I can coach the parent on very specific skills that are known to help kids be able to follow directions better, have higher self-esteem, have more emotional control and regulation. So that can be a really powerful treatment to see young kids' relationship with their parents getting better, parents feeling more confident that they can take their kids in public without their child, sometimes doing dangerous things like running into the street or really things that can be very embarrassing for some parents, like having a meltdown that can be aggressive in public.
So you kind of talked a little bit about how the therapy overall can be really effective in helping children be able to kind of like regulate themselves, and then also giving the parents a lot more reassurance in terms of like helping their children feel a lot more secure in themselves, and also give the parents a lot more understanding into how their children's minds work.
Mhm.
Would you be willing to talk a little bit about what is the science behind this? Like
Behind for the
behind
PCIT,
therapy? Yes.
the PCIT specifically, or therapy in
Yes.
general?
Behind
Yeah.
the PCIT therapy?
Yeah, absolutely. So PCIT, maybe it would be helpful if I started with an example. So one of the skills that we teach parents and we coach parents in PCIT is the idea of labeling their child's behaviors in a positive way. So sometimes what happens is that if a child's, acting in a way that makes it really hard for parents, doing things that are either unsafe or not the way that their parents want their kids to act in terms of politeness or what's expected in a certain situation, like keeping their voices down in a library or keeping their hands by their side when they're shopping and not grabbing everything on the grocery aisle, just for an example. So what we coach parents on is helping to them to focus their attention on what their child is doing well
Yeah.
and labeling that. So during a play therapeutic session, we help parents initially ignore unwanted behavior and really focus on anything that's positive and reflecting that back to the child.
Yeah.
So I might suggest to parents to, if a kid's, for example, having a tantrum, and then after 5 minutes comes back and sits at the table and picks up a crayon and starts coloring, I might prompt a parent to say, I love how you came back to the table and you picked my favorite color, red, something
Yeah.
like that. So I love how you came back to the table would be the labeled praise for a child's action. And often what we'll see is that after receiving that praise, a child will either smile or sometimes not, but continue to do something in a similar vein. Maybe they might draw more of a picture. Maybe they might talk about their internal experience. For example, they might say, yeah, I'm drawing a barn, right? Or they might offer more information. And from that, then we might be able to coach parents on a second skill, which is reflective or giving reflections. So if a kid says, I'm drawing a barn, the parent might say something like, oh, that looks like a barn that could have horses in it, right? And then it's more of a conversation that is a shared positive experience rather than the kid's experience of the parent saying, get back to the table, you shouldn't act like this, no, don't touch that. All of those things which can create more tension and make kids feel like they're constantly getting nagged.
Yeah, that seems amazing. I think it seems like it will be a very effective approach for many parents. For any viewers that might be watching this who want to know if this would be the right thing for them to look into for their kids, do you have any
Mhm.
advice on whether like which who should really seek out this kind of therapy?
Sure. So, any parents with kids ages 2 to 7, if parents are feeling a high level of stress around their kids' behaviors, then it would likely be a helpful intervention because it's one-on-one with a clinical psychologist. The coaching is very tailored, right? So
Mhm.
this can be done with kids with special needs, with autism. It can be done with kids with ADHD. It can be done with kids who don't have a diagnosis but might be really strong-willed. It can be done with parents who might want to be their best parent self, but feel like for whatever reason they're having a hard time going there, that might feel constantly annoyed by their child, or just feel like, I just don't know what to do. I don't know what to say in these situations. All of those are very appropriate times to look more into PCIT. And if people would like to find out more about that, whether they're looking at it from a parent point of view or teens who are listening today and are interested in like, would psychology be a good fit for me? You can go to pcitinternational.org and you'll see examples of therapists and pictures doing PCIT so you can get more of a sense of what it looks like.
Oh, that's amazing. And you kind of touched on my second question, which was, do you have any resources for students who might be kind of looking into like psychology and specifically clinical psychology and just want to learn more in general?
Sure. I think it depends on whether you're a teen or whether you're a college student. I think certainly I think a first entry is taking a psychology course or reading a book related to psychology, whether it's an autobiography about a person who has a very different lived experience than you, or some other, or something more about like behavior modification. Like how do we change our own behavior? How do we help change others or influence others' behavior? And
Mhm.
there's many, you can get really down to the nitty gritty in terms of studies with rats and research and how brains are structured. There's so many different avenues that you can go into of what and how behavior happens, whether it's from like the nitty gritty brain point of view, or whether it's from an attachment point of view in terms of how did you grow up with a primary caregiver and what was that relationship like. In terms of in college, there are, I think, a lot more opportunities in college to take different kinds of courses in psychology. So I definitely recommend, if you're thinking about clinical psychology, taking an abnormal psychology course. And there are also social psychology courses. I personally found that anthropology was a wonderful side entry into that as well. I would suggest looking for specific internships during the summer, different experiences. If you're interested in working with children, consider whether you volunteer at a camp for kids with special needs or with severe anxiety. I know that there are clinical training practices that are looking for college students who are interested to volunteer their time and be a one-on-one buddy for a child who's going through a very specific, intense therapeutic program. So I would look for those internship opportunities during the summer, or some are very research oriented. So would involve helping researchers go through data and find answers to the questions based on studies that are being designed.
Wow, that's amazing. I had a couple questions about kind of the college process and certain psychology degrees. So like you can either go down more like the BA track or more the Bachelor's of Science track. If someone was interested in going into clinical psychology, do you have any recommendations on whether it's more favorable to go down more the like bachelor's in art track or more of the bachelor's in science track, BA or BS?
I don't have specific recommendations on that. I think you can do it either way. And I think that different colleges offer different degrees too. But I think that both are great entry points to grad school, if grad school is something that you're interested in beyond undergraduate school. So
Yeah,
I think it's more about what the opportunities are that supplement your classes that will lead you on the track that is a great fit for you.
Yeah, that answers a little bit of my next question on like grad school as a whole. I know that it can be a really long process to become a clinical psychologist, and students aren't really sure whether it would be the right fit for them. Can you maybe talk a little bit about what your experience was like applying to grad school and what really helped you kind of stand out, and any advice you have for students that might be looking into grad school? I know that was a lot, but
Sure. Well, I think that I explored a lot in college, and I think that exploration is really helpful preparation for any clinical psychology degree because you're going to be working with really a diverse population of people. Even if I'm just interested in kids, I'm going to be working with their parents. And we live in Silicon Valley, and it's important to be able to provide help to people who might have a variety of beliefs and a variety of cultural backgrounds and lived experiences. So I think that giving yourself permission to follow what's really interesting to you in an internship, in a volunteer opportunity. For me, also doing the ABA for a year as a job in between and not rushing right into graduate school, I think was a great choice for myself. Graduate school for clinical psychology takes about 6 to 5, 6, sometimes 7 years,
Wow.
right? So you're looking at something akin to the timeline of med school. So that's something to keep in mind that it's important to know that that's what you would like to do, and that there are also alternatives. There are less involved ways of doing involved less time involved, I should say, degrees that you can earn, like a master's degree in either social work or in California, there's licensed in marriage family therapist degree, which is much shorter than a doctoral level degree. So you have options if you're feeling like, oh, I don't feel like I can/want to do the full doctorate degree, which involves a dissertation, which is a very long process of, for those who aren't familiar with it, it's basically like a long science-based term paper.
Oh, wow.
But for many clinical psychology candidates, it involves doing either novel research or working with an established psychologist on data sets that they already have to answer a specific research-based question. Did that answer your question, or is there more that I could say about it?
That's perfect.
Okay.
I know that for graduate school, there's a lot of writing and there's a lot of research, and it can definitely feel like a very rigorous program. So I think you summed it up beautifully.
Yeah, I will just say one other thing. I
Mhm.
do think that in terms of academic graduate programs that are going to be funded by universities, they're looking for more than just grades in terms of courses. I think they're looking for a person who's curious and genuinely interested and very passionate about that, about helping others in that area through a scientific lens.
Wow, thank you. That makes a lot of sense. I think at the end of the day, it doesn't really come down to just grades. You have to definitely be passionate about anything that you do and really show that intrinsically. I was curious on some of the highs and lows of being a clinical psychologist, right? So there is a lot of, I'm sure you feel a lot of satisfaction with helping so many people, but I think at times it can definitely be a little bit draining. So I was a little bit interested in hearing a little bit more about your experience and overall how you feel about the field.
Absolutely. Well, I definitely think like in any field there are highs and lows. Certainly the best feeling for me in my work is seeing progress for one of my clients. And that looks, very different depending on the client, but it's probably the most obvious with me for younger clients who might be particularly anxious and want to do something but can't by themselves. And it might be something that other peers can do. So it might be sleeping in their own bed at night. It might be going on a roller coaster. It might be going up and talking to another kid at school. So I find that when their joy at that and that degree of confidence that it builds, and then they're that much more open to trying new things, really be inspiring. You can really feel like, yeah, I had a great day because I felt like I was able to really help someone in their life. And I think the lows is that life is really messy and really difficult. You know, I think there's a saying that no one goes through life unscathed, and I think that's very true. So, I meet with people who've had really difficult, horrible things happen to them sometimes. And to be able to hold that space for them and be compassionate, but also not be so overwhelmed myself that I can't help them is a tricky balance and something that you learn through lots of experience and supervision and such. So, there are many days that I go home and the I'm thinking about clients, right? Because I care. And sometimes it's hard to shut that off. It's not a 9 to 5 job where, okay, I'm done. My mind is still going, or I might have an idea in the middle of the night about how I might help a particular client. I think it also, for children and teens, a lot of the success depends on collaborating with parents. And parents have their own things going on. So sometimes that collaboration can go very smoothly, and sometimes it can be very challenging if parents are in a place that they're kind of in survival mode. We work with parents, of course, who are going through a divorce, or parents who are going through their own trauma, etc. And that can be tricky to navigate.
Yeah, thank you. I think you've summed that up perfectly. Before we close, do you have any final things that you would like to add, or any things that I didn't mention in my questions? Or any tips in general for high
Sure.
school students or prospective clinical psychologists?
Yeah, I think now is an exciting time in the field of psychology. And there's so much direction and push towards more AI this, more AI that. And I think there's certainly ways that AI can be helpful in terms of supporting people's mental health. But we are wired for connection as humans. And there's a special healing and encouragement that I feel like can only be received in community from another person. So there will always be a need for clinical psychologists. And I think that's really important to take a step and recognize what is really unique about helping another person through their life.
Thank you. Thank you for sharing that. I think that there's a lot of talk around AI and how that can kind of change the trajectory of psychology careers. But I think that as people age, I think a lot of the people in our healthcare and mental health care systems are going to really be at the backbone of our society at times, right? We're going to need people to listen and be able to support different individuals. So I think that's really important. I think that I've definitely heard a lot of talk about different fields and different professions that will be taken over by AI, but I think that psychology may be impacted, but I think that it's still a very important career, and I think that people should definitely look into pursuing it. So, yeah,
Yeah,
as we close, I would like to thank Dr. Kuhn for spending the time with me today, and I learned so much from you. So, thank you so much for joining us.
welcome. Thanks for
Um,
having me, Annika.
Thank you. Um, I would like to um, I would like to make sure that everyone checks out some more episodes from Mindful, Beautiful, and Thriving, and tune in to watch more videos on our Therapist Off the Clock series. Thank you so much.
Bye.
Bye.
You are listening to Mindful, Beautiful, and Thriving, a podcast series by Tharaka Foundation. As part of our youth series, we will be releasing new episodes every month, so make sure to continue to check those out. We hope you enjoyed this podcast, and we thank you so much for listening.